Hello and welcome to Dear Doctor, the medical YouTube channel where we discuss the latest and most trending topics in health and medicine. Today we're going to talk about the new guidelines for lung cancer screening. Who should get screened, how often, and what are the advantages and disadvantages of early detection? Let's find out. Lung cancer is the leading cause of cancer death in the United States, killing more people than breast, prostate, and colorectal cancers combined. Lung cancer is often diagnosed at a late stage when it has already spread to other parts of the body and is harder to treat. That's why screening for lung cancer is important, as it can help find the disease at an early stage when it is more likely to be cured. Screening for lung cancer means testing people who do not have any symptoms of the disease, but who are at high risk of developing it. The only recommended screening test for lung cancer is a low-dose computed tomography (LDCT) scan, which uses X-rays to create a detailed picture of the lungs. The LDCT scan can detect small nodules or growths in the lungs that may be cancerous or precancerous. However, not everyone needs to be screened for lung cancer. Screening is only recommended for people who meet certain criteria, based on their age, smoking history, and health status. The American Cancer Society recently updated its guidelines for lung cancer screening, based on the latest evidence and research. According to the new guidelines, screening is recommended for people who are aged 50 to 80 years, have a 20-pack year or more smoking history, are either current smokers or have quit within the past 15 years, have no signs or symptoms of lung cancer, are in good health and willing to undergo treatment if lung cancer is found. A pack year is a way to measure how much a person has smoked over a long period of time. It is calculated by multiplying the number of packs of cigarettes smoked per day by the number of years the person has smoked. For example, a person who smoked 1 pack a day for 20 years has a 20-pack year smoking history. A person who smoked 2 packs a day for 10 years also has a 20-pack year smoking history. If you meet these criteria, you should talk to your doctor about the benefits and risks of lung cancer screening, and decide whether it is right for you. You should also discuss how often you need to get screened, and where you can get screened. The American Cancer Society recommends that people who choose to get screened should do so every year until they turn 80, or until they have not smoked for 15 years, or until they develop a health problem that limits their life expectancy or their ability to have lung surgery. The main benefit of lung cancer screening is that it can save lives by finding lung cancer early when it is more treatable. Studies have shown that screening with LDCT can reduce the risk of dying from lung cancer by 20% to 26% among high-risk smokers. Screening can also help detect other lung conditions, such as chronic obstructive pulmonary disease (COPD) or emphysema, that may need medical attention. However, lung cancer screening also has some risks and limitations that you should be aware of. Some of these are false positives. This means that the LDCT scan shows something abnormal in the lungs, but it is not cancer. This can cause anxiety and stress and may lead to more tests or procedures that are not needed and may have side effects. False negatives. This means that the LDCT scan does not show anything abnormal in the lungs, but there is cancer. This can give a false sense of security and may delay the diagnosis and treatment of lung cancer. Overdiagnosis. This means that the LDCT scan finds a lung cancer that would not have caused any problems or symptoms in the person's lifetime. This can lead to unnecessary treatment that may have side effects and affect the quality of life. Radiation exposure. The LDCT scan uses a low dose of radiation, which is much lower than a regular CT scan, but still higher than a chest X-ray. The radiation exposure from one LDCT scan is unlikely to cause harm, but repeated scans over time may increase the risk of developing other cancers. Therefore, lung cancer screening is not a substitute for quitting smoking, which is the best way to prevent lung cancer and improve your health. If you are a smoker, you should try to quit as soon as possible and get help from your doctor or a smoking cessation program if you need it. Quitting smoking can reduce your risk of lung cancer and many other diseases, and can also make you eligible for less frequent screening or no screening at all. That's all for today's episode of Dear Doctor. I hope you learned something new and interesting about the new guidelines for lung cancer screening. If you liked this video, please give it a thumbs up, share it with your friends and family, and subscribe to our channel for more videos like this.